After reviewing the bones of the appendicular skeleton on the upper extremities, we'll now take a look at the lower extremity bones, beginning with the hip girdle. Remember earlier we mentioned that there are two girdles that are part of the appendicular skeleton, which would be the shoulder girdle and the pelvic or hip girdle. The pelvic girdle refers to three bones: the two hip bones, also called ilium, on each side, as well as the sacrum in the middle, with the sacrum being part of the spine. So what you're looking at on this slide is a single ilium. On the left, you can see that each ilium is actually further subdivided into three parts: the ischium in red, the pubis in purple, and the ilium superiorly. So those are the three main parts of the ilium. The diagram on the right shows you a view of an ilium, and this happens to be a right ilium looking laterally. And let's identify a few of the main structures. First, right in the center in yellow, we have the acetabulum. The acetabulum is where the head of the femur will fit, and the acetabulum is also sometimes called our hip joint. So we know that we're looking at a lateral view of this bone because I can see the acetabulum, which is on the outside of the ilium. The acetabulum is actually made up of a piece of each of the three regions of the ilium: the ischium, pubis, and ilium. At the inferior end of the acetabulum, we have an acetabular notch. Moving inferior and anterior, we have the region of the ilium called the pubis, which has several structures to identify. We have the pubic tubercle. We have the obturator foramen, which is the largest foramen or hole made by bones in our body. And again, this is just inferior to the acetabulum, in between the pubis and ischium, and this large obturator foramen is a space for things to go through, things like vasculature, nerves, muscles, and so forth. The places on the pubis that almost look like little connector pieces are called rami. So you'd have a superior ramus of the pubis above the pubic tubercle, and an inferior ramus of the pubis right below before it turns into the ischium. So working our way clockwise on the right diagram, we're now at the region of the ilium called ischium. We have at the lower end an ischial tuberosity, which is also called your sit bone. So that's one of the ways that I know on an ischium what side is anterior and what side is posterior. So on your reading left of this diagram, that is the posterior side of this ilium. So you'll notice that you see an ischial tuberosity, and some of the projections on the posterior side are significantly larger. In addition to an ischial tuberosity on the ischium, we have an ischial spine. The ischium also has a body and a ramus. Just superior to the ischium, with a little purple mark, is the greater sciatic notch, which naturally will hold the sciatic nerve. We do have a lesser sciatic notch just inferior to the ischial spine as well. So anytime something is named greater, that means you know that there will be one called lesser somewhere on this bone. On the ilium, just superior to the greater sciatic notch, we have two structures that have very similar names in blue and red: the posterior superior iliac spine and the posterior inferior iliac spine. Sometimes we abbreviate these iliac spines because there are actually four of them. On the anterior side in green and orange, you'll see the anterior superior iliac spine and the anterior inferior iliac spine. So sometimes these are abbreviated. For example, in blue, the posterior superior iliac spine, we might call that the PSIS. So the PSIS is, if you feel on your low back, you kind of feel those two little hooks just above the sacrum, or some people actually have dimples on their low back. That would be the general area of the PSIS, posterior superior iliac spine. So some of these structures can also be used as exterior body landmarks. The anterior superior iliac spine, or ASIS as an abbreviation, would be the projection that you can feel on the front of your hip bone. The ilium also has a large iliac crest across the top. So these two ilium or hip bones, the left and right, in conjunction with the sacrum posteriorly, will make the pelvic girdle. The head of the femur, which is the large bone in our thigh, will articulate with the acetabulum to form a ball and socket joint. And that acetabulum is composed of all three of the bones that will make up the ilium. We can actually further subdivide the pelvic girdle. So when we put the left and right ilium and the sacrum together, we get our pelvic girdle, which will divide into a superior and inferior portion. The dividing line will be the pelvic brim. So the pelvic brim is the large open hole when you're looking S to I down the pelvic girdle that's created by the sacral promontory posteriorly. We'll wrap around each side with the arcuate line and meet anteriorly at the pubic symphysis. The pubic symphysis is actually a joint that sits in between the two pubic tubercles. If we take that same concept of separating the pelvis into a superior and inferior portion and we turn it to the side, here's the view we'll look at. So in this image, you're looking at the bony sacrum and spine on the reading left or posterior side, and then the purple circle represents the pubic symphysis anteriorly, where the two pubic symphysis will meet to form the the two pubic tubercles will meet to form the pubic symphysis. If we drew a line between that sacral promontory and the pubic symphysis, we'd create that superior and inferior division of the pelvis. The superior portion above the pelvic brim is called the false or greater pelvis, shown in red. In blue, we have the true or lesser pelvis, which is the area of bony pelvis that is inferior to the pelvic brim. If we took that same concept of an upper and lower division above and below the pelvic brim, we would see this anteriorly with the false pelvis, represented in pink, and the true pelvis, represented by the bony landmarks in blue. The male and female pelvis or pelvic girdle will look different in a number of ways. A male pelvis is usually larger and heavier in weight. The reason that a male and female pelvis will look different is because of the anatomical requirements for pregnancy and childbirth. So a female pelvis will be wider and shallower than the male pelvis. Let's transition from the pelvic girdle to the bones of the lower extremity. And we'll start with the most superior lower extremity bone, the femur. The femur is the longest, heaviest, and strongest bone in our entire body. The proximal head will fit into the acetabulum of the hip bone to create our hip joint, and the distal end of the femur will articulate with the tibia and our patella, or kneecap, to create the knee joint. In this diagram, we are looking at an anterior and posterior view of the femur. On your reading left is the anterior view. Much like the humerus in the arm, the femur will have a head which fits into the acetabulum and a neck. It will also have a greater trochanter in orange and a lesser trochanter in blue. Again, like the humerus that you've already learned, the femur will also have a body or shaft. On the posterior side of the body of the humerus, we have a large, very visible line called the linea aspera. Linea aspera. At the distal end of the femur, where the femur will articulate with the tibia and patella to form the knee joint, we've got a couple of different structures here. From the anterior view, which is on your reading left, we can see the patella. If you recall, the patella is a sesamoid bone, so it's actually not connected to any other bones. It sits within the tendon, and it has a very mechanical function. On either side of the patella, you'll see projections. Also, these look like the humerus in the upper arm. These projections will be called the lateral and medial epicondyles. If we look at the posterior view on the right in purple, we've got a different structure called the lateral and medial condyles, and these are better seen from the posterior view. So you could think about the condyles in purple as the hooks and projections on the back, and in yellow, the hooks and projections that stick out on the sides will be the epicondyles. Posteriorly, we also have an intercondylar fossa between the medial and lateral condyle of the femur. Inferior to the knee joint, we have the leg, which is made up of the tibia and fibula. It's easy to get these two words confused, but if you remember that the fibula is lateral, the LA at the end of fibula will remind you that it's the lateral bone. So the tibia is the more medial and larger bone. In yellow on this image, I've highlighted some of the structures of the tibia for you to pay attention to. At the proximal or superior end of the tibia, we have a medial and lateral condyle. Just in between and inferior to these two condyles on the anterior side, we have the tibial tuberosity, which is a large bump that you can actually feel as an external landmark below the patella. The tibia also has an anterior border, or sometimes called anterior crest. And our projection at the distal end of the tibia is called the medial malleolus. Medial malleolus. As an external landmark, you'll know the medial malleolus because it's actually your inside ankle bone. Our fibula is the lateral, much slimmer bone, and the fibula has a head and at the distal end a lateral malleolus. And again, you'll know that lateral malleolus because that is actually your outside ankle bone. Similar to the bones of the hand, we have the bones of the ankle. Now, the ankle is also called the tarsus, so for that reason we will call the bones of the ankle the tarsal bones. And there are 7 of them. So we have 8 carpal bones in the hand and 7 tarsal bones. Those tarsal bones are named the talus, the calcaneus, which is our big heel bone, the navicular, the cuboid, and we have 3 cuneiforms, which are called medial, intermediate, and lateral cuneiform. The foot also has 5 metatarsal bones, and notice that instead of saying metacarpal, we'll use metatarsal. And just like those metacarpals, they're numbered 1 through 5, number 1 being the big toe. The metatarsals will make up the sole and dorsal side of the foot. The proximal ends of the metatarsals will articulate with the 3 cuneiform bones and the cuboid, all starting with a C. The distal end of the metatarsals will articulate with the proximal phalanges. The phalanges are arranged exactly like the hand. Your big toe, like the thumb, will have a proximal and distal phalanx, and the other toes will have a proximal, middle, and distal phalanx, just like the bones of the hand. I'd like to take a much closer look at the tarsal bones when we're in class on our models, but I would like to spend a moment on this diagram. The image on your reading left is a view of the right foot, S to I, so we're looking down on top of it. All the way at the posterior edge, we have the very large heel bone, which is called calcaneus. Just medial to the calcaneus, we have the talus. And the talus is actually the large bone that's going to articulate with the tibia to form the ankle joint. Just anterior to the talus, we have the navicular. Anterior to the navicular, we have the 1st, 2nd, and 3rd cuneiforms. 1st, 2nd, and 3rd cuneiforms are also called medial, intermediate, and lateral cuneiforms, with those words being used interchangeably. And all the way on the lateral side in front of the calcaneus is the cuboid. The metatarsals are also labeled number 1 through 5, with 1 being the big toe. And then we have the same phalanges as we'll find in the hand. When we meet again for lab, we'll also review the 3 arches of the foot and what effect those arches have on the alignment of our musculoskeletal system. The musculoskeletal system plays an important role in homeostasis of every other system in the body, both directly and indirectly.